All right, hello and welcome to this debate regarding the use of restraints and seclusions in individuals with developmental disabilities. My name is Caitlin Diller and I will be the introducer for this debate. We have chosen to use an informal structure for this particular debate, and we will be discussing the pros and cons of using restraints and seclusions. We will begin the debate with Michaela, the pro summarizer, who will be supporting the use of restraints and seclusions and how they are in the best interest of the individual, how they keep the individuals from self-harm, and how they keep staff and others safe. Rachel-Mae Curtis will be illustrating the three main points with visuals. And secondly, we will hear from Casey Kramer, the researcher, who will be discussing the current research that was found on the use of restraints and seclusions. Third, we will begin with the con side of the debate, where we will hear from Abby Waterman, who will be discussing the use of least restraint measures, and illustrations will be given by Rachel-Mae Curtis again. Fourth, Casey Kramer will then be discussing current research on least restrictive measures. And lastly, we will hear from the fielder, Rachel Marks, who will give frequently asked questions and touch base on specific points. We are now ready to begin our debate with Michaela.
Thank you, Caitlin. As stated previously, I will be supporting the use of restraints. There are three main points that I will make about the use of restraints. The first point I will cover supporting the use of restraints is that restraints are in the best interest of the individual. I first want to state that restraints should only be used, cannot be managed with less intrusive means. According to MOSA, the use of restraints should be viewed as an extraordinary event and limited to the recommended indications. Restraint requires a written order by the physician, and its use should immediately be discontinued when less restrictive alternatives are feasible. Restraints are only in the best interest of the individual when all other methods of behavior modification have been attempted and proven unsuccessful. It is also important to remember that all people should not be restrained in the same manner. According, again, to MOSA, the type of restraint or seclusion used should be determined by the characteristics of the patient and what is in his or her best interest. Before a restraint procedure is implemented, the staff should take an in-depth look at what they want to accomplish by using a restraint, and also how to eventually fade out the use of restraints from the client's care plan. There were instances where restraints are necessary, however, they should not be used without thorough planning being in place. MOSA also stated that guidelines should be developed in every psychiatric setting dealing with and when to act, whether to administer restraints and the duration of a restraint. Legal and regulatory controls need to be implemented to monitor the use or misuse of restraints. This must be tempered by acknowledgement of the need for added resources that ensure adequate staffing and training in the appropriate use of these procedures to prevent violence. One of the most important things to remember and autonomy of our clients should always be considered when implementing a restraint. The basic dignity of patients who have been restrained should be protected, and they should be provided with regular personal hygiene, bathroom, exercise, nutrition, and fluid breaks. Patients who are restrained should be provided with a comfortable environment that supports and maintains human dignity. Should we stop? And if we get farther, then we're just gonna have to do it again. Still muted.
This technology is not working.